Health officials say several children have been treated in hospital after a fast-spreading measles outbreak in North London. About a third of the almost 100 cases reported in England this year of the highly contagious virus have been in the borough of Enfield, while measles cases have been rising in the UK and in parts of the globe, with the increase blamed in part on poor uptake of the vaccine. Misinformation is such a huge problem. How do you think that can be managed to ensure that people do get the correct medical information?
Misinformation is such a growing problem, and I agree. I think it's the top contributor to the spread of measles here in the U.S. and elsewhere. Unfortunately, there are a number of myths and misconceptions that continue to spread, including this idea that measles is mild, and some actually believe that it might be beneficial for us, which could not be further from the truth. So what I think we need is clear messaging and guidance from our government, from our healthcare professionals and our clinicians that help set the record straight.
And what is the current guidance, vaccination guidance, for people who do want to make sure that they are protecting their children?
Absolutely. So typically, at least here in the States, children get their first dose of the MMR vaccine at 1 year of age, and then a second dose between 4 to 6 years. Now, if you're in an active outbreak area, you can actually request that your child get an early dose of the vaccine as young as 6 months of age. One other thing I'd love to flag is that if adults are unsure if they've been fully vaccinated against measles, they can actually go ahead and get a dose of the MMR vaccine. Some people think that they have to go and get their titers checked to see if they have immunity, but you don't need to do that. You can skip that step and safely go ahead and get a dose.
And Jess, as you mentioned there, some people sometimes fall into that trap. They just don't know whether or not they have been vaccinated previously. So what are the symptoms to look out for if they are worried?
Yeah, so some of the symptoms seem like other viral illnesses, right? You get fever, you can have runny nose, and of course that telltale rash. For most people, cases are quite mild, but even if you recover from measles, there are other things that can develop. Two things in particular that I don't think people are aware of is something called immune amnesia, which means that measles effectively wipe out our immune system's memory. So all the other things that our bodies have been trained to protect us against, our bodies forget that, making us more susceptible to illness. And immune amnesia occurs in all people who have measles, even mild cases, but there are different levels of it. The other thing is something called SSPE, which is encephalitis or swelling of the brain, which can actually occur 7 to 10 years after the measles infection resolves. And if you do unfortunately get SSPE, it is almost always fatal.
Jess Dyer, really good to get your thoughts there. Thank you very much for being with us here on BBC News.